If you have a strong family history of heart disease, you might feel like your chances of a heart-related problem is already predetermined, and that no matter what you do, you are destined to develop heart problems. But the truth is that your genetics are only one part of the equation. While having close relatives with heart disease does increase your risk, it doesn't guarantee that you will develop it yourself. It really is just one risk factor. What truly matters is how you respond to that knowledge and what steps you take to protect your heart and lower your risk. In this video, I'm going to explain exactly what a family history of heart disease means, how it affects your health, and most importantly, what you can do to take control of your heart health starting today. Hi, I'm Valerie, a wellness nurse. I believe that no matter your age or current health status, that you have the power to take charge of your well-being and live a longer, healthier life. My goal is to share with you the knowledge and tools that will empower you to make that happen. If heart disease runs in your family, you might feel like you are fighting an uphill battle. But the good news is your lifestyle and daily choices play a major role in determining your future heart health, and likely a larger role than family history alone. Understanding your family history is an important step, but what really matters is how you use that knowledge to protect your heart and lower your risk. There are proven ways to protect your heart health, even if heart disease runs in your family. So let's take a closer look at what having a family history of heart disease actually means, and more importantly, what you can do about it. Having a family history of heart disease means that one or more of your close relatives, so like a parent or a grandparent or a sibling, has been diagnosed with heart-related conditions like coronary artery disease, heart attacks, high blood pressure, or strokes. Your risk is even higher if a first-degree relative was diagnosed at a young age. So this is before the age of 55 for men or before 65 for women. The earlier heart disease appears in your family, the more significant the genetic component might be. But family history is about more than just genetics. It also reflects shared environments, lifestyles, and habits that have been passed on. If your family has a history of eating a not so heart healthy diet, or a lack of exercise, or things like smoking, these factors may be just as important in shaping your risk as your genes. So genetics are passed down, but so are lifestyle habits. Genetics can predispose you to conditions like high cholesterol or high blood pressure, but your lifestyle choices can either amplify or counteract those risks. This is why understanding your family history can set you on the road toward taking proactive steps to protect your heart. The first step is to understand your individual risk. This means talking with your family members to learn about their heart health history. Ask about things like past heart attacks, strokes, or conditions like high cholesterol and high blood pressure. The more you know, the better prepared you will be. Once you have that information, talk to your doctor about that and your other risk factors for heart disease. Depending on your history, they may recommend a heart health check, advanced cholesterol testing, or screening for conditions like hereditary high cholesterol. But knowing your risk is just the beginning. The most powerful thing you can do is to focus on prevention. One of the biggest myths about heart disease is that it happens suddenly. In reality, heart disease usually slowly develops over decades. The choices you make today determine how your heart will function years from now. Your diet plays a critical role. Prioritizing a heart-healthy, plant-predominant diet that includes plenty of vegetables, fruits, whole grains, and healthy fats can significantly reduce your risk. Omega-3 rich foods like flax seeds, walnuts, and fatty fish help lower inflammation and protect against plaque buildup. At the same time, cutting back on processed foods, refined carbohydrates like sugar and white flour, and saturated fats can make a huge difference. Physical activity is another major factor. Regular exercise strengthens the heart, improves circulation, and helps regulate blood pressure and cholesterol. Aim for at least 150 minutes of moderate intensity exercise per week. But more movement is always better. Even things like daily walking, strength training, or yoga can have long-term protective benefits. Maintaining a healthy weight also plays a role, especially if high blood pressure, diabetes, or other metabolic issues run in your family. Even small, sustainable weight loss, like just 5 to 10% of your body weight, can significantly reduce your cardiovascular risk. And if you smoke, quitting is one of the most powerful things that you can do for your heart. Smoking damages the arteries, raises blood pressure, and increases the risk of heart attacks and strokes. The sooner you quit, the more your body can heal. Taking control of your heart health also means staying on top of key heart health markers. Keeping blood pressure, cholesterol, triglycerides, and blood sugar levels within a healthy range is important for preventing heart disease before it starts. If you have a family history, it is a good idea to get these numbers checked and get them checked regularly, especially as you get older. If anything is elevated, it is better to know early so that you can make the necessary changes before it becomes a bigger issue. For some people, additional testing like lipoprotein, apolipoprotein, or even coronary calcium scoring may be helpful to get a clearer picture of your risk. These tests go beyond basic cholesterol numbers and can provide a deeper understanding of how your cardiovascular system is functioning. And perhaps just as important as knowing your numbers is recognizing the warning signs of a heart attack or stroke, especially if you are a woman, since symptoms can be different in women than in men. If something feels off, don't ignore it. Advocating for yourself and taking symptoms seriously could save your life. I have a whole video on how the signs of a heart attack in women differs from the classical symptoms seen in men. I strongly encourage all women to learn these differences. I will put a link to that video in this video's description. Having a family history of heart disease can feel overwhelming and maybe even a little scary, but it's important to remember that your genes are not your destiny. They may set the stage, but you have the power to influence how your health unfolds. The best thing you can do is to take action now. Small, consistent changes like eating better, moving more, managing stress, and getting regular checkups can make a huge difference in your long-term health. Even if heart disease runs in your family, it doesn't have to define your future. Please let me know in the comments if you have a family history of heart disease. What steps are you taking to protect your heart? Would you like to learn more what you can do? And if you like this video and want to learn more about heart health and what you can do to live a longer, healthier life, please like this video and subscribe to this channel so you don't miss future videos. Thank you so much for watching, and as always, please take good care of yourself.